Hello everyone. Let's discuss the forensic question of our CBOT examination. I'm your forensic faculty, Dr. Sumit Tellewar. Let's take up our first question. Our first question is: a 15-year-old boy was brought to the emergency with history of ingestion of oil of vitriol 2 hours ago. So, an important information is given that there is ingestion of oil of vitriol 2 hours ago, and this is a boy of 15 years of age. Which of the following is incorrect about the management of this patient? Right? So, the first thing that we need to highlight in the question is what is oil of vitriol? Oil of vitriol is another name for sulfuric acid, and we know sulfuric acid is the most potent, most strong mineral acid, right? And if there is an ingestion of sulfuric acid, there is bound to be heavy corrosion in the digestive tract, starting from the mouth itself, involving the esophagus, the stomach, and everything. Because sulfuric acid is very, very strong, one thing which is definitely contraindicated in the sulfuric acid poisoning is attempting to neutralize the pH of strong sulfuric acid with a base. Okay, because if you are going to give a very strong base into the stomach, there is going to be an exothermic reaction, a huge exothermic reaction in the stomach, and the stomach wall can perforate, which itself can happen with the sulfuric acid ingestion only. But then we don't want to induce it, right? So if you see option number one, neutralization with base, it's an absolute non-choice, that we don't need to neutralize sulfuric acid with giving a very strong base. So correct option here is option A, that we do not try to neutralize sulfuric acid. So if you see that what can we do in acute emergencies, we can give very mild bases, but definitely not attempting to neutralize the strength of sulfuric acid. The mainstay of the treatment is demulcent. It coats the stomach membrane and delays the further absorption and acts as a barrier. Yes, endoscopy can be done in the initial hours, up till 4 days of acid ingestion, but not beyond it, because there is huge risks of stricture formations. And chest X-ray, PA view, yes, that may be a required investigation to see if there is any kind of perforation anywhere else. So all other statements are absolutely correct. They may be utilized during the therapy of the patient, but attempting to neutralize is absolutely not a choice. The second very important thing that we need to remember about sulfuric acid poisoning, time and again we keep on repeating it over and over again in our lectures, और हम इसको मेमोराइज भी काफ़ी अच्छी तरीके से करते हैं. वो चीज़ क्या है? सल्फ्यूरिक एसिड पॉइजनिंग is a situation which is an absolute contraindication for gastric lavage. Okay, so remember, this is a situation which is absolute contraindication for gastric lavage. The reason is same. अगर सल्फ्यूरिक एसिड की इंजेक्शन से स्टमक वॉल की थिनिंग होती है और अभी तक स्टमक वॉल परफोरेशन नहीं हुई है, हम गैस्ट्रिक लवाज ट्यूब इंजेस्ट करके वो परफोरेशन कर सकते हैं. सो सल्फ्यूरिक एसिड के केस में गैस्ट्रिक लवाज नहीं करना है. लेट्स टेक अप आवर सेकंड क्वेश्चन. क्वेश्चन में हमें एक ग्राफ दिया हुआ है, एंड द क्वेश्चन सेज एनालाइज द ग्राफ given below. Which curve represents the post-mortem lividity changes? The answers are red line, yellow line, blue line, or green line. Okay, so in the question, it is being talked about post mortem lividity. What is post mortem lividity? Post mortem lividity is post mortem staining. Is post mortem staining, also called as PMS, also called as hypostasis, also called as vibesis, also called as darkening of death, and also called as uh, livor mortis, right? So postmortem staining के बहुत सारे synonymous name है. The question is very simple: which graph represents postmortem lividity? Okay, to understand this question, let's try and draw uh, all the postmortem changes, the common ones, and let's see उनका graphical representation किस तरीके से होगा. So commonly what do? We simply draw an x-axis and a y-axis, right? y-axis में x-axis में टाइम है और y-axis में ड्यूरेशन है. सो ड्यूरेशन नहीं है, y-axis में मैग्नीट्यूड होगा चेंज का. सो अगर हम सबसे पहली बात करें, अ वेरी वेरी प्रोमिनेंट ग्राफ दैट वी ऑब्जर्व इज ग्राफ ऑफ पोस्ट मॉर्टम कूलिंग, ऑल्सो नोन एज एल्गर मोर्टिस, राइट? तो अगर ये टाइम है तो दिस इज 0 hour, यानी कि राइट एट द टाइम ऑफ डेथ द टेम्परेचर्स ऑफ द बॉडी आर हाई, क्लोज टू 37 degrees. So at 0 hours we will find that post-mortem cooling will start from a higher temperature. What will happen then? वो धीरे धीरे over a period of time नीचे आना चालू होता है, right? Having the phase 1, phase 2 of the curve and phase 3 of the curve. ये तीनों phases हम अपने classes में पढ़ते हैं. So this is phase 1, then it starts to decline, which is phase 2, and then it keeps on coming down, and then after a while it plateaus again, which is called as phase 3. So this is an ideal graph of post-mortem cooling, which is a sigmoidal shaped graph, as you can see, or an inverted S shaped curve, right? दूसरा जो हम देखने वाले हैं वो important curve कौन सा है? That is about rigor mortis. So rigor mortis is something which does not start right after death. Okay, so we are going to observe building of rigor mortis few hours after death, which means it will start to build up somewhere from here, and the rigor mortis builds up, builds up, builds up. It keeps on going with increasing time, right? And then after a while it peaks up, and after peaking it starts to come down. So when it starts to come down, a time comes when it is completely gone. So it will originate from x-axis and it will come back to the x-axis itself. This is the graph of rigor mortis, right? Which is basically a parabola. Third thing that we need to see is post-mortem staining, जो हमसे question में भी पूछा हुआ है. Now post-mortem staining is also something which begins around rigor mortis and it keeps on getting more and more as the post-mortem staining keeps on building more and more in the dependent portion of the body. Then when it has built up enough, it doesn't really go down. So when it is built up enough, it just stays like this till the time the decomposition of the body starts and the outer discoloration, that is the blackening of the body at the time of decomposition, starts. So it kind of camouflages the appearance of the rigor mortis. Rigor mortis उस external blackening में थोड़ी छुप जाती है. So with increasing decomposition, the rigor mortis may just post-mortem staining may just be seen going little bit down, but वो कभी खत्म नहीं होगी, तो वो x axis पे दोबारा नहीं पहुंचेगी. Okay? और चौथी चीज क्या है? चौथी चीज है the decomposition of the putrefaction itself. And again, the putrefaction will start somewhere around the time of when enough time has elapsed. हम अपनी classes में पढ़ते हैं generally the first sign of external sign of putrefaction is around 18 hours when the right iliac fossa discoloration is seen. Okay, तो putrefaction कहीं यहाँ से start होगी और फिर ये बॉडी के डिकम्पोजिशन के साथ बढ़ती ही जाएगी. इट विल नॉट कम डाउन, इट विल कीप ऑन गोइंग अप एंड अप एंड अप. सो इस तरीके का एक लीनियर प्रोग्रेसिव ग्राफ इट सजेस्ट putrefaction, right? So the first one was alger mortis, the second one is rigor mortis, the third one is post-mortem staining, and the fourth one is putrefaction. So after this discussion, if we come back to our question and if we observe the graph given in the question itself, which graph do you see representing post-mortem lividity? It is the blue line. So correct answer here is option C, blue line, right? You can see the red line represents alger mortis. This orange line represents rigor mortis, and this green color line represents putrefaction. Okay, let's move to our next question. Cadaveric spasms may be seen in all except. Cadaveric spasm कब कब मिल सकता है और कब नहीं मिल सकता? The four choices are drowning, suicide by firearm, electrocution and traumatic asphyxia. Okay, तो सबसे पहले देखते हैं what exactly is cadaveric spasm. Cadaveric spasm is a condition where muscle of body goes into spasm, or you can say rigidity, just before death, and it remains like that after death. Okay, so रिजिडिटी तो डेथ के बाद में राइगर मोर्टिस में भी मिलती है, बट राइगर मोर्टिस डेथ के बाद एकदम से दिखाई नहीं देता. राइगर मोर्टिस विल टेक टाइम टू बिल्ड अप. अभी पिछले क्वेश्चन में भी हमने देखा राइगर मोर्टिस इज नॉट सीन एट 0 hour एट डेथ, बट कैडेवरिक स्पाज्म इज समथिंग which will be seen right at the moment of death, because just before death certain group of muscle it it has gone into a rigidity phase and remains rigid at the time or after death also, which means the normal cycle of primary muscle relaxation or the normal phase of primary muscle relaxation जो muscle में first change आता after death, that phase is bypassed. We straight away see rigidity, and that's called as cadaveric spasm. Now, why this condition develops in a dead body? It does not develop in every death. So there are certain conditions where cadaveric spasm is seen very commonly, or they may develop in those kind of deaths. Let's see what are these. These are situation of death due to excitement, fear, severe pain, exhaustion, cerebral hemorrhage, firearm wound to head, drowning and strychnine poisoning. मोस्ट कॉमनली जिसके बारे में हम बात करते हैं और जहाँ से बार बार क्वेश्चन आता है एग्जामिनेशन में, वो ड्राउनिंग का कैडेवरिक स्पाज्म है. रिमेंबर लॉट ऑफ टाइम वी शो यू फोटोग्राफ्स ऑफ हैंड्स होल्डिंग ऑन टू वीड्स from the bottom of the sea or bottom of water source where a drowned body has been found. That's an example of cadaveric spasm, indicating that it's an ante-mortem death, right? So if we go back to our options, what are the situations where cadaveric spasm may not be seen? That's traumatic asphyxia. As you can see, that's traumatic asphyxia. It can be seen in drowning, it can be seen in suicide by firearm if there is a shot to head, it can be seen in electrocution, severe exhaustion of the muscles of the hand, But traumatic asphyxia is something where cadaveric spasm may not be seen. Next question. Which of the following organs of the body offers maximum resistance to electrical injury? वेरी स्ट्रेट फॉरवर्ड क्वेश्चन. हम अपनी क्लास में डेफिनेटली इस क्वेश्चन की बात करते हैं व्हेन वी टॉक अबाउट थर्मल डेथ्स एंड इलेक्ट्रिकल इंजरी, राइट. द सीक्वेंस इन विच द tissues of the body offer resistance to electricity is skin offers maximum, followed by bone, followed by fat, followed by muscles, followed by blood, right? Which means if you look at these sequence, skin is most resistant to करंट. सो गॉड ने हमारी बॉडी को भी ऐसे ही बनाया है, जो सबसे आउटर मोस्ट लेयर है हमारी बॉडी की, वो ही करंट को सबसे ज्यादा रेजिस्ट नॉर्मली करती है, राइट. एंड ब्लड, if you'll see, is the last in the list, which means it is the best conductor of current in the body because resistance सबसे कम है, which means it will be conducting the current best. So after reading this kind of a flow chart, what do we see? The option is option C. Skin is the maximum resisting tissue of the body for electrical injury. Next question. A 45-year-old chronic alcoholic became agitated following abstinence from alcohol. So one important thing which is given in the question itself is abstinence from alcohol, and he is abstaining from alcohol for last 3 days. Last 3 days means close to 72 hours. Okay. He developed tremors, confusion, delirium, and disorientation to time, place, and person. He can hear the voices of his late mother who died 6 months back. Okay, these kind of things are called as horror hallucinations. You know, hearing the voices of dead, seeing somebody who is dead, horror hallucinations. Okay, so he's having horror auditory hallucinations. What is the drug of choice for the above condition? See, the first thing that we need to see here is what is the condition, what is the emergency that has precipitated in this person. The emergency is called as delirium tremens, right? The emergency is called as delirium tremens, right? Delirium tremens is a condition that often precipitates in people who are chronic alcoholic, number of years or history of number of years of alcohol intake, and then suddenly they stop taking alcohol, and it typically precipitates 48 to 72 hours later. So 2 to 3 days is the precipitating time. What happens in delirium tremens? The situation or the symptoms, those have been written: tremors, confusion, delirium, disorientation, horror hallucinations. One important thing to remember in case of delirium tremens is the person becomes violent. He can hit other people who are trying to calm him down. So it's a situation which is well attached to violence, right? And in this situation of agitated behavior, confusion. Many people kill themselves also. So it is well known for committing suicides also. Okay, so remember, suicides are committed. And when I say the person becomes violent, what can it lead to? It can lead to attack on others. He can attack other people and injure other people. This is called as delirium tremens. Okay, so it's a very important situation where the person has to be calmed down, where needs to be taken care of as soon as possible, and the best choice of drugs are benzodiazepines, preferably long-acting benzodiazepines. And once the delirium tremens has precipitated in that person, the fastest acting methodology would be giving him an IV benzodiazepine. So correct option here is option C, right? And once the person is calm after IV benzodiazepine, later on you can put the patient on oral long-acting benzodiazepines like diazepam or chlordiazepoxide. But to take care of the acute emergency situation, an IV drug would be preferred. Okay, a 19-year-old girl visited the OBG department for pain in her genitalia. On examination, she reveals that last night she had sexual intercourse with her boyfriend. The doctor found some contused abrasions with minor lacerations around the genitalia. The doctor also observes and documents that the hymen is relaxed and intact. This is a case of. The options are rape, medical negligence, true virgin, or false virgin. Okay, the first thing is age of the girl is 19 years and she has had sexual intercourse with her boyfriend, which means she had a consensual sexual intercourse, and because her age is more than 18, it does not amount to rape. It does not amount to rape, right? So rape as a choice is automatically out of the window, right? uh, the doctor has examined the female and observed what are the clinical findings in her and has noted down all the findings, so it doesn't look to be a case of medical negligence, right? Nothing like that has given in the question also. So what remains with us is true virgin or false virgin. Now, who is a virgin female? Normally we say it is the female who has never experienced sexual intercourse, right? What is the most expected finding in her genital examination? That her hymen will be intact. Hymen may rupture or it does rupture as early as first sexual intercourse, right? So true virgin would be a female who has never experienced sexual intercourse, and on examination her hymen would be found intact. But in this case, the female has a history of having sexual intercourse with her boyfriend, but on examination the hymen is relaxed but intact. You can see it is intact. What does it mean? It means although she has had sexual intercourse, but the hymen is still intact, which is giving a false sign that she may be a virgin, right? These kind of females are called as false virgin. So correct choice here is false virgin. Okay, so let's see what other examination findings can we see in cases of false virgins. So this table gives us the findings in cases of false virgin. So if you look at hymen in both the cases, that is true virgin or false virgin, in true virgin the hymen is intact, elastic, covering the vaginal opening. The edges of the hymen are distinct and regular. Okay, whereas in false virgin, the female who has had sexual intercourse but the hymen is intact. So intact hymen is found in this setting also, but the hymen is little less elastic. It is relaxed. The edges may be found rough and thick because of repeated penile penetration through that relaxed hymen, and 1 to 2 finger penetration may be possible through that intact hymen into the vaginal cavity. Clitoris is small in true virgin. It will be enlarged in false virgin. Fossa navicularis will be intact in true virgin, and it would have disappeared after sexual intercourse in false virgin. Okay, vaginal walls in true virgin, they are opposed vaginal walls, collapsed vaginal walls होंगी, उसमें स्पेस नहीं होगा, रूमी नहीं होगी. So rugosities will be very prominent. इनको बोलते हैं रूगेज. So vaginal wall के रूगे जो होंगे वो बहुत prominent होंगे. So vaginal walls will be rugose. Walls are opposed, narrow cavity. Whereas what will be seen in false virgin, very roomy vaginal wall. Okay, breast firm and non-pendulous in true virgins because they have not yet experienced in sexual intercourse, and we are expecting to see large and flabby breast in cases of false virgin. So these are some very important clinical examination signs to differentiate between true virgin and false virgin. Very commonly हमारे examination में यहाँ से question आता है. Okay, our next question is: a dead fetus was found in a dustbin. Police started an inquest and along with the inquest brought the fetus to the forensic department to know the age of the fetus. On examination, the length of the fetus is seen as 25 centimeter. 25 centimeter, if you recall, rule of Haas, according to rule of Haas, the 25 centimeter fetus would be 5 months of intrauterine life, right? 5 का square 25 or 25 का under root 5. In the first 5 months, the length of the fetus is square of the number of months. Okay. Which of the following statement is true regarding this fetus? So let's read all the statements. The first statement is the fetus was viable. It's a false statement because viability starts at 28 weeks, which is 7 months, right? The second statement is the ossification center of talus has appeared, which is again a wrong statement. This appears again at 7 months. It's an indicator of viability of the fetus itself, the ossification center for talus. The ossification center for calcaneum though appears at 5 months, right? तो अगर यहाँ पर talus की जगह calcaneum लिखा होता तो हम उस statement को right मान सकते थे. Third statement is crown to rump length is medico-legally more important than crown to heel length. It's a very correct statement, right? Because crown to rump length is from the top of the head to the bottom of the buttocks, which is a very standard length for fetus. उसके बाद में क्राउन टू हील में उसके लोअर लिम्स भी आते हैं, वहां पर लेंथ वेरिएबल हो सकती है इन डिफरेंट फीटसेस. सो क्राउन टू रम्प लेंथ is more accurate, so medico-legally more important than crown to heel length. And testes was found at the external inguinal ring. ये finding जो होती है ये 7th to 8th month की finding होती है. This finding again is 7th to 8th month. In fact, more towards the 8th month finding, right? So, which means the only correct statement is crown to rump length is medico-legally more important than crown to heel length. This question is all about understanding different changes that happens in the body of the fetus. So हमें rule of Haas भी पता रखना है, हमें ये भी पता रखना है कि कौन से important ossification centers हैं बॉडी में, वो किस टाइम पे आते हैं, ताकि हम इंट्रायूट्राइन फीटसेस या इंट्रायूट्राइन डेथ में फीटल की जेस्टेशनल एजिंग कर पाएँ. और डिफरेंट टाइम पे नेल्स की ग्रोथ कैसी होती है, एक्सटर्नल चीज़ जो हमें आराम से दिखती हैं, टेस्टिकुलर डिसेंट किस तरीके से होता है, राइट? तो ये सारी चीज़ें देखते हुए क्वेश्चंस हमारे एग्जामिनेशन में फीटस के एजिंग पे आते हैं. और ये सारी चीजें हम अपने क्लासरूम में कवर करते हैं। राइट, आगे चलते हैं। While recording evidence in court of law, the lawyer asked the witness, "Did you see that Mr. A killed Mr. B?" This type of question is permitted in. Okay, this type of question is permitted in. The options are examination in chief, cross examination, re examination, या direct examination. The correct answer is cross examination, because if you read the question says, "Did you see that Mr. A killed Mr. B?" It's a leading question. Leading questions are commonly asked in cross examination, right? And who is the cross examining lawyer? By defense lawyer to prosecution witness, राइट। तो प्रोसिक्यूशन का विटनेस है तो उसको क्रॉस एग्जामिनेशन डिफेंस लॉयर करेगा, और डिफेंस लॉयर क्रॉस एग्जामिनिंग करते समय उससे लीडिंग क्वेश्चन पूछेगा, एंड लीडिंग क्वेश्चन का आंसर यस या नो में ही हो सकता है। द विटनेस विल बी बाउंड टू आंसर इन यस और नो। So that's the idea of asking the question, that do students know that cross examination is the time period when leading questions are asked by the lawyer of the opposition to the witness of the opposition. Right. With that, we come to the end of discussion of all the questions in CBOT. Stay tuned for the next one. I'll meet you again. Till then, jam ke padhai